going to put you on the hot seat right off the bat. We are very friendly with Representative Ash Kalra, who presented the CalCare bill, was able to make it through a couple of committees, but the word went out pretty quickly through Newsom's, what you would call handlers, I guess, that basically said, if this bill gets to my desk, I'm going to veto it. And so if CalCare, which is a universal healthcare system, were to get to your desk as governor, would you sign it into law?
Unlikely. And the reason is that I just don't know that it's necessary. You know, I think that, so first of all, it wouldn't have made it to his desk, I don't think. So I'm not sure I believe that story. That sounds like a story told by somebody who wanted to basically accuse the governor of being the main obstacle to it. The governor promised single payer healthcare, universal healthcare when he ran. He knew he couldn't deliver on it. He doesn't tell the truth. He has a difficult relationship with the truth. I think a better approach is to start with psychiatry. We have a urgent humanitarian disaster right now in terms of psychiatric care. I have a strong moral belief that we should have universal health care and then we should start with universal psychiatry, but I'm pragmatic about how we get there. You know, when I was in the Netherlands, they explained they have universal health care, but it's not single payer. They just achieved it similarly through the way that we've done it through a private insurer model. They just basically subsidize folks who can't afford it to get the insurance they need. But it's not, in some ways, I admire the simplicity of the single payer system that they have in Canada and France, but I don't think we necessarily have to have it. And you have a kind of system that has been in place since really for over 100 years of a private insurer model. I think we can work with that. I'd like to take on challenges that we think are ones that we can solve, you know, rather than taking on quixotic battles. So for me, I think that would start with universal psychiatry, not single payer.
I understand what you're saying. Obviously, we're very big advocates for universal health care. I think you are definitely taking the more moderate approach, fighting battles that you can win. Obviously, it's a very daunting task to take on private insurance and big pharma. But what we always try to message is the key ingredient here is eliminating the for-profit middlemen in between us and our doctors. They do not have a reason to exist. They are a complete bloat on the system, especially when you consider how California in particular has a serious budget crisis, I guess you could say. And I think that is obviously that is an issue where I think you would agree, Jen, we are definitely not going to be on the same page on. But I do think that is a key ingredient in terms of how you ultimately rally a lot of people, because I do think we're going to get there. Like you said, it's a question of how it's going to happen. Maybe it's a statewide initiative first before it moves to the federal level. That's what we think is probably most likely. But I do think that is a key ingredient. Would you say that it's fair that the for-profit middlemen in between us and our doctors is a big problem, and we do have to address that?
I don't know. I mean, like I said, if it's such a big problem, then why did Netherlands achieve universal health care in a private insurer model?
Well, because in the United States, we don't have a choice. In the United States, you have to buy insurance. Whereas in the Netherlands and other parts of the world, private insurance is an option. If you want to be on the private system, they even have that in the UK and other parts of Europe, which I think makes a lot of sense. If you want to have that private supplemental insurance, I don't have a problem with that. Would you agree?
No, but that's not accurate. That's not what the Netherlands. That's not the Dutch model. The Dutch model is similar to our model. They've achieved universal health insurance coverage through a private insurer model. They just went ahead and just think of it as what they did is it's just Obamacare extended to the whole population. So, you know, like I said, I'm not, I don't have any spiritual, there's something about the single payer model that I find elegant, but it's not the only way to achieve universal health care.
That's fair. Well, we can leave it there.
Yeah, I mean, that's fine. I mean, just for me, healthcare shouldn't be a profit industry. It's just not, it's like, corrections, education, healthcare, these are things that to me should just be part of living in a civilization. One of the benefits of having the resources that we have and the wealth that we have, that should just be something that we have. And when you add a profit motive to those things, we end up in the capitalistic implosion. in which we're in, where it's completely unfettered, unregulated. It's like the Wild West of capitalism. And that's the problem. And those other countries are very highly regulated in what they do. Like, their government doesn't let their pharmaceutical companies rape their people on a daily basis. Those countries don't have medical bankruptcies accounting for half of people's bankruptcies. Like, I just think that it's because they don't allow their corporations to rape their people to the level that ours does. And as long as it's a profit motive, we're just going to have that.
Yeah,
I think that's part of it. Although I would also, I hear what you're saying, and I agree in part. I would also point out, though, that, what I get to in San Francisco, my book on homelessness, crime, and the environment, where I describe the Dutch model. I mean, I think that, for example, they did not have an opioid crisis. They did not overprescribe opioids. Mm-hmm. So there's two parts to that. On the one hand, for sure, doctors had an incentive in the United States to overprescribe opioids. The pharmaceutical industry had an interest in selling opioids. They manipulated the regulatory process. At the same time, there was a kind of cultural demand from people for pain meds at the grassroots level, where there was a sense of entitlement. I should not have to have any pain. And it was at all levels of the culture. Whereas when I talked to folks in the Netherlands, there was much more a sense of, you have to tough it out. You have to, I'll give you an example. I had an appendectomy last year.
I've been there.
And, first of all, it's totally brilliant surgery, the way they do it now, because it's just a laparoscopic surgery. It's a one-day procedure. It's quite amazing. And they just crank through people. It's very efficient. But then when they sent me home with a little bottle of opioids.
Oh, yeah.
Not a lot, but a few. And I said, why are you giving these to me? And they were like, well, because you might need them. And I was like, but do we think that Advil, which, by the way, I think is a wonder drug, and I'm a huge advocate of Advil. I was like, do we think Advil won't work? And they were like, it might work, but just in case it doesn't. See, the Dutch don't do that. That you would say, come back if you need the pain meds, or even, there's just more. I quote, there's a Dutch saying. I explained this difference to a friend of mine in Holland, and he goes, the Dutch have a saying, soft doctors make wounds stink. Meaning soft doctors don't scrub the wounds and make them bleed and get them properly clean, and then they get infected and stink. That was the folk expression. And so I think there's something there, and that's part of where the book goes. And this is, I think, where I am trying to get post-ideological, where, yes, on the one hand, I agree that you need universal entitlements to have a civilization, including a right to shelter, a right to healthcare. But I also think you need something in the culture which says, you have to take responsibility too. You can't sleep on the sidewalk. You can go into shelter. You can go into rehab. You can get psychiatric care, but you can't sleep on the sidewalk, because the sidewalk belongs to all of us. And you might cry about it. You might say that you're oppressed or you're a victim, but that's not acceptable. You have to tough it up. You do need tough love. There is some reciprocity here around some obligation. And similarly, I don't think that we should create the entitlement among our children that things should be easy. We're having a thing here in California where the governor's people are trying to get rid of algebra before high school. Why? Because
it's hard.
Because it's hard, and because there's racial disparities. Less than a third of all public school students are math proficient. Only 10% of Black students, only 15% of Latino students are. We all feel bad about this. Nobody likes these racial disparities. But the answer is to study more math. The answer is a longer school day. The answer is more homework. The answer is not to lower the standards. And so for me, where San Francisco comes out and where I came out of my campaign is we need to get to a rebalancing of entitlements and responsibilities, that there's some social contract where the society does have certain obligations to the citizens, but citizens as individuals also have obligations to society.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.